Welcome to this coaching session on VA disability ratings for knee conditions. I'm Paul Bunn with Veterans Outreach, and today we're diving into how the VA evaluates knee injuries and impairments. We'll cover everything from flexion and extension to instability, arthritis, meniscus injuries, replacements, and even painful motion. Let's break down what each rating means and how veterans can prepare for a successful C&P exam. The VA uses specific criteria to rate knee conditions. These include limitation of flexion and extension, instability, ankylosis, damage to the meniscus, arthritis, both degenerative and traumatic, as well as the impact of partial or total knee replacements. Painful motion also plays a role, and we'll get to that shortly. The key to success: understanding how each condition is measured and described. Limitation of flexion refers to how far the knee can bend. A veteran will receive 30% if flexion is limited to 15 degrees, 20% if it's limited to 30 degrees, 10% for 45 degrees, 0% if they can still bend to 60 degrees. This is typically measured during the C&P exam, and accurate documentation matters, especially during flare-ups. Extension deals with how far the leg can straighten. The more limited it is, the higher the potential rating. 50% if extension is stuck at 45 degrees, down to 0% if it's limited only to 5 degrees. Veterans often overlook this, but extension limits can significantly affect mobility and qualify for serious ratings when properly documented. uh, Instability of the knee 30%, severe recurrent subluxation or lateral instability 20%, moderate recurrent subluxation or lateral instability 10%, slight recurrent subluxation or lateral instability. If the knee gives out, wobbles, or requires a brace, those are red flags worth documenting in both exams and statements. Ankylosis means the knee is essentially frozen, unable to move past a certain point. 60% extremely unfavorable. Flexion at 45 degrees or more, 50%. Flexion between 20 degrees and 45 degrees, 40%. Flexion between 10 degrees and 20 degrees, 30%. Favorable angle in full extension or slight flexion. This is rare, but if present, it's one of the highest rated conditions due to the severity of loss of function. For the meniscus, we're looking at two conditions: 20% if the meniscus is dislocated and causes locking, pain, and swelling; 10% if the cartilage has been removed and is still symptomatic. Veterans should explain episodes where the knee locks, pops, or swells up without warning. A degenerative arthritis is when arthritis leads to limited motion. 20% if there's x-ray evidence and incapacitating episodes. 10% for x-ray evidence and consistent pain can also be rated under limitation of motion codes if more beneficial to the veteran. After a knee replacement, veterans automatically receive 100% for 1 year. Then it drops to 60% for chronic pain or limited motion, or 30% for milder residuals. It's important to describe how the new joint functions or doesn't, especially if you're still in pain or limited in movement. Here's a key point to remember. Even if a veteran still has a decent range of motion, if it causes pain, that's a compensable disability. Under 38 CFR section 4.59, painful motion itself counts as functional loss. Veterans should never downplay pain during the exam. They should talk about frequency, duration, and how it limits their day. Preparation is critical. Veterans should describe how pain and flare-ups affect walking, standing, stairs, and squatting. Be honest but clear about their worst days. Bring records, imaging, physical therapy notes, anything that shows the impact. We also recommend tracking pain episodes with a calendar if possible. This next slide shows Visual examples of normal and impaired knee movement. Use these visuals to help understand the degree of flexion and extension you experience and where they may fall on the rating scale. Here's a simplified visual reference showing how the VA measures degrees of flexion and extension. This can be a helpful tool to understand what the different range of motions look like. Sometimes showing is easier than describing. To wrap things up, here are the official 38 CFR regulations that govern knee condition ratings. You can always look at the 38 CFR online for additional information.